Recording
How's
in
Cairns?
Cairns. Cairns is nice, you know. The temperature is around 24 degrees. At night, there's a little bit of wind this last few days. Uh,
Yeah.
this last week, it was like summer. Temperatures were 28 degrees. It was great. And then the cold came back for a little bit.
Yeah, well, that's Australia for you. In Perth, I don't know, where is everyone from tonight? We're going to start live in 2 minutes, but let's have a look who's on tonight so far. Just a few of us, and yeah, I'm in Perth, and as you know, and we've even had hail this week. Yeah, it's been quite intense, you know. So hi, Vicky and Suzanne and Rob and Katrina, and we've got Ben and Melanie. So yeah, it's the weather everywhere has been insane. Hi. Hi, everyone.
It consists of so many different, just different places, you know. Seoul has like crazy amounts of rain, and then there's just weather issues everywhere. Makes me wonder whether or not there normally is plenty of weather things. We just don't hear about it, right? And then now they decided to share it with us.
Yeah, that's the thing. You just don't know. You just don't know what you don't know. But obviously, you know, yeah, it is really diverse around Australia. I've been talking to a lot of people on the East Coast, also in Byron Bay, and it's beautiful over there at the moment, where you said just a few months it was horrible. So, you know, but anyways, we can't really trust the news to tell us the weather. So you just got to experience it for yourself wherever you are.
Do something to your hair.
Did I? A bit blonder?
A bit blonder, yeah, I think so.
I'm still just as wise though, HB, okay? Oh, goodness. Yeah, sometimes you got to just change it up. Well, everybody, it's 5:30, so I'll just kick right into it. And welcome to Global Wealth Club Wednesday midweek catch up with everyone. I'm Jasmine, and we have, I know you don't really like being called doctor, but we have our amazing doctor back. We'll call him HB because that's what he likes. HB here with his presence. And maybe for those who haven't seen you before, you can do a really quick intro like always, and then we can get into what's going on. And James put out a little slogan for tonight's webinar. Did you see it? Our marketing?
Yeah, I did see it.
Yeah, it was pretty funny. It has the world gone bananas, and that's all because of this monkeypox stuff that's going on. So very good marketing team. Anyways, go ahead and introduce yourself.
Yeah. Well, look, my name is HB, and then I work as a GP, right? I specialize in skin cancer, and then I also have a exponential health program that I created to take someone who is struggling with their health and then experience what it's like for the first time regaining their youth that they've had in their 20s. So that is a process that we take people through a deep dive and really go and cleanse out the body, figure out what things are holding them back, more specifically deep diving into the various aspects of life, particularly the mind, the body, the spirit, and then drilling down into the food, water, and air that they breathe. So putting that all together into a package and getting people into the right rhythms, routines, and rituals so that they can sustain this over time and continue to enjoy that exponential health rather than break down in their 40s. So that's a little bit about me. I would rather help people than talk about myself. So let's go.
Good, let's do it. Let's help people. It's just always nice to know a little bit more about what you do. And look, I think it's great to mention that you do that health program. And yeah, we'll touch a little bit more on that later for those who really want to know a little bit more information. Because one thing I think that a lot of people have come to the conclusion of, especially in the last couple of years, HB, is that without your health, you don't have anything, you know, because you can't enjoy the other parts of your life. So, you know, we really are going to be looking at doing a new series. Let us know what your thoughts are in regards to just health and how to maintain a health, you know, your mind, body, and soul, as well as your physical, you know, yourself, because it's so important. There's so much happening. And in you as a doctor, you will see a lot of people coming in, you know, and I remember our last conversation, you mentioned so much of the flu so early was happening, and there's a lot of testing that was going on. But now we got monkeypox that's hitting the news, and we know there's a lot of propaganda. But I guess to just settle everyone's mind, would you be able to, share from your perspective what you see is happening at the moment with this monkeypox, and is it something that people should really be looking into or concerned about?
So I think before we even jump in and talk about monkeypox, it's important to understand how things have actually shifted since the whole COVID situation, right? Undoubtedly, a lot of the audience or people they know, whether or not you have had the vaccine, would have experienced something that is quite unusual. So a couple of years ago, if you had the flu, it would take you 2-3 days, maximum a week, and then you'd be back to normal. But that's not happening this year, right? Like I have people who are doing this. They're cycling. They're getting better, then they're sick again. They're getting better, then they're sick again. And they come in all kinds of different symptoms. Like people who are chronically tired. They go like, when I sleep and I wake up, I just don't have any energy anymore, right? Or every afternoon, I feel like I need to take a nap. Or my headache keeps recurring. I just feel like it's getting under control and then it comes back. Or cough. Or like sore throat. There's just all of these respiratory type symptoms that keep repeating themselves over and over again, even though the person supposedly have recovered, right? And interestingly, I see that in the population who think that they're doing all of the right things for their health, right? But what they don't realize is that health is an entire package. You can't just go, well, I eat well, but I have a lot of stress at work, or I have a lot of stress at work and I have a bad relationship, and I eat poorly, and then that's like the trifecta, then they're not going to recover, most likely. So now, why is that happening? And you really need to understand that the immune system is not defective. So it's either something is causing a depression within the immune system, or there is a virus that is able to evade everything and continually infect and reinfect you, which we've never seen before, and I'm pretty sure does not exist. So if something's affecting your immune system, then you need to go, well, what is that thing, right?
Yeah.
And this is where I think monkeypox then comes into the picture, because like if you had taken monkeypox and say, hey, we're seeing a 500% increase in this particular kind of pox, then how much increase are we seeing in cancer, diabetes, heart disease, right? Like they are not reporting any of those numbers. But if they were, we would be seeing a concurrent rise in all of those things. Then we'd be like, oh my gosh, people must be smoking a lot more because lung cancer rates are going up, right? People must be sunbaking because melanomas are going up, right?
Yeah.
Like all of these diseases, which are supposed to be chronic, supposed to come decades later, are accelerating, and they're happening sooner, right? So from my point of view, it's not so much that it's a new entity, but they've decided that they want to focus on it, right? So they say, okay, here's the thing that's called monkeypox, but right, what about the rate of measles? What about the rates of tonsillitis? What about the rates of any other disease that you can think of, right? So I think what we have is basically an epidemic of a depressed immune system. And on top of that, just having a whole bunch of toxic components put on top of us, right? The toxic news that is coming in, creating the fear, the uncertainty, the doubt, the worry, and that is causing a depression in the immune system. Our constant, exposure to the news cycle to say that there is all of these bad things happening all around the world, right? May not affect you. But, look at how bad it's here, how bad it is, how bad it is. And then you're stuck at home going, well, I think I better stay at home because it's so scary outside, right? So there are a lot of these different things that are coming together and forming the perfect storm so that your immune system is not functioning well, right? We haven't even gone to having the vaccine or having COVID or having anything else that would add to that particular mix. And we know that if you have stress, if you have other things that are going wrong in life, how easy it is to have a healthy lifestyle, right? Like, how many people go and exercise? We'll be like, that's probably the furthest things from most people's mind, right? How many actually take time to prepare healthy, nutritious food? How many actually take time out so that they can have a break during the day rather than burn out, right? not a cigarette break, but actually a break and then breathe in fresh air rather than smoke. So
Yeah.
little things from all areas of life are culminating. And that's what I see, like say, okay, there is this particular disease that is coming out. I see a lot of diseases coming out, and they are all in my mind relatively equal measure, I would say.
Yeah, right. So, okay, so you're talking about, I guess it's what measured is what is shown, right? So they're measuring specific types of viruses at the moment. So in this day and age where news and, all these things are just so in your face, how is it that you can come to a place where you can come to truth, but even in yourself, if you're just not sure of something and you're thinking, well, I don't know if it's a risk, I don't know, what is the thing that they should be focusing on? Like you're talking about getting back into yourself, just the things that you can control.
Yeah, absolutely. But at the end of the day, we have zero influence of anything outside this body, right? It's the same for me, it's the same for you, same for everyone who's attending today. And when I think about the health of an individual, like it's really dependent upon your initial mindset going in, right?
Yeah.
So I see sick patients every single day. Like our clinic is one of the few clinics in Cairns whereby if you have a fever, if you have sore throat, if you have runny nose, if you have a cough, you can come in and sit in my office, right? Because I don't care that you are sick. Like you are sick. I'm not sick. So why should I be afraid that you are sick? Right? And that is a very important place to start, because if your belief is my immune system is weak and I am going to catch everything that goes around, it will become a self-fulfilling reality, right? Because we know scientifically that what you think becomes reality because it influences all of the hormones and the cascades of endocrine function inside the body to make that happen. If you are fearful, you lower the immune system. Like how many people have had the experience whereby they think, oh gosh, I've had such a hard day, I hope it's not raining. You go out, it's raining, you're like, okay, now I'm going to get sick. And then the next day you're in bed. You're like, wow, look at that, predicted the future. I was like, well, no, your body just went, hey, you gave me a command. I am going to carry it out, right? So really standing guard at the door of your mind and not letting things affect you and really understanding where your health sovereignty lies is a very important thing. Right? You need to think about it almost as if you're teaching your child to protect themselves, right? Like from young, you're taught, okay, there are certain parts which are private, nobody gets to actually touch them, right? And we guard it with such fervor because we know that that's something that cannot be crossed, right? But we allow all kinds of influence to come into our mind to tell us what is healthy and what isn't, without really cross-checking it with the intuitive body ourselves, right? So getting yourself to the state whereby you are impervious to outside influences should be like one of the very first thing people do to try and cement their health, right? We're not talking about food, not talking about water, not talking about breathing, even though those things are really important. But if you don't even believe you're going to be healthy, you're not going to do all of those things, right? If you don't believe you can lose weight, you're not even going to try. So we have to fix the thoughts that are going around in our head. What are the assumptions going around? We go, oh my gosh, right? There's this other disease. Oh, there is this other virus that is coming aboard. Oh, there is this other mutation that is happening. Now, talking about mutations on a slight tangent, right? My patients come by and then they say, Doc, what do you think about this new variant that's coming out? It completely evades the immune system. So even if you've caught COVID before, even if you've had the vaccine before, it doesn't work.
Wow.
And I'm like, okay, let's put on our thinking cap for a bit, right? So what would you call something that is completely unrecognized by the immune system if you think it was, like if disease A mutated so much that it's no longer recognized by the immune system, do you still call it disease A? Like, no. That's how we tell the difference between different viruses. We go, this is the influenza virus, this is the gastro virus. They're completely different. And if you have an influenza virus, you will not detect gastro because they're not the same. So if something evades the immune system, it's not the same thing.
Yes. Yeah.
So to talk about a variant as if it can mutate so much, it's like it's a new thing. Come on, like, you explain this to any. I'm surprised immunologists are not on TV going, "What kind of rubbish is this?" Like you're saying, "This is an apple, this is an orange." Of course, your immune system doesn't recognize it. They're not even in the same class.
Yeah.
Anyways,
Yeah.
that's just some of the inconsistencies that I'm seeing.
Yeah, and in those inconsistencies, if it's happening in the medical field, I mean, no wonder why everyone else is even more confused. And, there's a panic going on worldwide now. And as you said, going back to your thoughts and going back to your mindset, for example, like we all talk to ourselves in our mind all the time, it's our thoughts.
Mm-hmm.
That your subconscious mind?
No. I think there are different levels, right? So you have the pre-consciousness whereby you might be thinking in the background, but it doesn't become true to you, right? So this happens, for example, when you're driving and then you're driving along and you literally lose context of the driving, and then your mind takes over, right? And you're on autopilot, and then you're thinking about something all the way about what's for dinner, where am I going on a romantic trip during the weekend, and then suddenly something will happen which switches your attention to then focus on what is in front of you, right? So we have different levels of consciousness that we can shift in and out of, but what is more important than the label is that we have access to all of those, and you can access each level depending on what it is that you do and how you train yourself to, right?
Yeah.
More so than the subconscious, it is those conversations, the beliefs that are deep-seated inside our minds that we need to be examining and challenging, right?
Yes. Yes.
So if you simply think about your health and you go, how healthy am I? On a scale of 0 to 10, you're like, I am 9. Okay, great. You go, what is the one that is missing? Right? Your mind is going to give you the answer straight away. It's going to say, well, I don't exercise. All right, good. Right? And you go, is there anything else I don't do? Right. Well, actually, I love sweets a bit too much. Okay. Is there anything else that, you don't do? And you're going to get more and more answers, right? Because now you have that gap that starts to widen and you can see clearly what is happening. Most people don't even ask the question. They go, hey, I'm a 9. Ah, awesome. Right. And then they just say, right, this is how it feels, not really examining it any further. And the same for the other spectrum. So if you go, look, I feel like about a 4, my health is really not that good. You'd be like, what's making it a 4? What is missing? What are the 6 portions there that you have deducted? And it's like, oh, I'm surrounded by sick people. My husband doesn't believe in healthy eating. So, I have to cook 2 different meals for the family. My kids constantly have peer pressure, and then they go to birthday parties and we have to prepare different type of food for them. And I don't really want them to feel excluded, right? So now you go from, well, what does your health have to do with all of those different things, right? You start chaining everything else and then you go, it's too hard, right? So just accept that I'm not performing as well and that my health is not as great, right? It just becomes a whole soup of things, which is generally how most people function, as opposed to really taking a clear look and then saying, hey, what is the problem? I'll give you an example, right? Like this is a mental block that is quite common. I have a patient today who came and then say, doc, I just cannot lose weight. It's like, I'm between 100 and 130, right? Every time I go to 130, I do something, I lose weight, I get to 100, and then I just can't get past 100, right? When I get to 100, then I balloon back out to 130. So my patient is excellent at keeping her weight in between these 2 ranges. You go, why is that? Why can she do that but can't get past the 100? Because there is a certain belief she has about what it means as being 100. Yeah. So whenever I see her, then she's closer to 100. Guess what happens? She's like walking around all proud. She's like, all right, I've got this. I've lost the weight. I'm heading towards 100. And then guess what? The behavior creeps back in to go, all right, because I'm doing so well, I can now eat a little bit more. Because I'm doing so well, I get to reward myself, right? And she doesn't realize that this is happening. And she goes, 6 months passes, it's like, I'm 130 again. Like, what happened, right? So even though from the outside, it's very easy for me to actually see, if we don't help them see what those beliefs are inside their minds, it's impossible to be able to change the behavior and therefore get a result that's going to be long lasting, because that belief is always going to counteract any external willpower that we try and impose upon it.
Yeah. Oh, that's brilliant. I couldn't agree more. So, you know, in the comments, we've had a few, you know, Sandra and Spreed has said, you know, there's a lot of discrimination going on if you're not vaccinated or whatever it may be. You know, there's certain doctors that won't see patients. What are your thoughts around that? Because there's a lot of injustice happening in the world. There always has been. So would you kind of bring that down back to yourself? Maybe you need to find another doctor and then just not feel like, you know, you're a part of that system or you know, supporting that. Like, what are your thoughts around that? Because I think it always comes back to you and your choice. Like, you want to see that doctor or maybe choose someone else. What are your thoughts there?
Look, I think we have had it easy, right? Like, something like this happens, and then you really have to examine the prior relationships you have had and what those actually mean. More often than not, health is a matter of convenience. You go, okay, which doctor is open? Who can I go to get my script? Who's going to see me at a time that's convenient for me, right?
Yeah.
We are now in a situation whereby you are actually dealing with value transfer, right? So now you get to figure out, hey, who actually has your back versus who is just following the cookbook, right? And if you're like, all right, well, I don't like the person who just follows the cookbook, then absolutely, you need to find someone else. If you feel violated because a doctor is not willing to do something for you, well, maybe they're not the right person for you. But we need to look at that both ways. Maybe your expectations are not appropriate, right? So, like, even before COVID, if a patient came by and then say, hey, doc, look, I'm just here and then I want all of these scripts, and then hands me a list, I don't go, okay, here you go, right? I'm not a shopping service. You don't just come and then say, you tell me what it is that you want. Like, my job is to ensure that we don't miss any health concerns. And secondary of all, to try and keep you healthy before you go out, rather than just keep you ongoingly sick, right? You're taking tablets for a reason. How about we try and get you off those tablets? Some people like to do that. Other people no, right? And why I would rub some people up the wrong way and be like, well, you've been on blood pressure tablet. Would you like to come off them? They're like, no, it's been working fine, right? I'm like, you don't suffer any side effects? I don't think so, right? I'm overweight. My joints hurt. I can't sleep properly. But no, life is generally pretty okay. Because we get used to things. It is so easy to get used to anything. We can get used to such incredible abuses. It's unbelievable, right? So when we're talking about these, again, it comes back to the mindset and really where you are at as a person. And if you feel discriminated against, then maybe you need to find your own tribe, right? Go and find the people who are like-minded and share the same belief as you so that you can get the same care as you. I was actually thinking about this myself today as I was walking down the corridor in my clinic. I was thinking to myself, if I get sick, I don't want to be here. Like, that is what went through my mind. And I was like, that's an interesting thought, you know? Like, I would do everything I can to avoid the emergency department, right? But if I had to go there, then that means that either my life is in danger or my kid's life is in imminent danger, and then I cannot solve it, right? But for everything else, if I have a musculoskeletal issue, I would rather go to, a good physiotherapy, perhaps a Bowen therapist, maybe, like an Alexander technique therapist, a chiropractor, osteopath, right? There will be different people that I would want to go and see because I believe in the kind of skill sets that they have. And then after I've seen them, my expectation is that I'm going to get information that would help me prevent what happened. Not, right? Whereas if I go and see a doctor, I'm going to get a pill, more than likely, right? So that's a little bit of an insight to just see, even as a doctor myself, I'm like, man, I don't like the way that my system functions, right? Like how the medical system is structured. So if I'm going to go down that track, I have to be willing to accept what it comes with. And currently, if you don't wear a mask, you can't go to hospital, right? Like it doesn't matter what the reason is that you don't want to wear a mask, or you can't, right? I'll give you an example, which is like blows my mind. I have a patient who basically had very bad experiences in terms of being sexually abused, right? And because of that, she has a phobia and gets triggered when there is something over her face, right? Not difficult to understand. Any female would say, yeah, no, totally. There's a good reason not to actually wear one. But do you think anybody gives 2 cents? No. You're like, well, you don't wear one, you can't step foot into the hospital. And they're like, you're asking me to do something that's going to trigger a full-on panic attack. Like you want 2 problems instead of 1.
Wow.
Right? So, and that's just one example. And there are many other reasons why people cannot wear masks, irrespective of whether or not they work, right? Like today, one of my patients came in, massive rash over the face. And it's like, I don't know what's going on. I've never had this before. I'm like, looking at what you're wearing on your face, you probably haven't washed it for 2 weeks. And he's like, no, in fact, I probably, have washed it once in the past 2 months. And I'm like, that's why you have a rash, because what's growing is what you're breathing out and, colonizing the actual mask and then now seeding back onto your face. And he was like, right. Like disposable masks are supposed to be worn once, thrown away. They probably last a couple of hours, if that. Yeah, but there's so much misinformation, right? Like there was a paper released just a week ago on Nature, which is one of the premier scientific publications. And in Nature, they said, what do masks actually prevent? And then they show you, this is how big a virus is. This is how big a bacteria is. This is how big the holes are within the mask and how they cannot actually filter any viruses. And it was like, well, we have known this for 2 years, right? And then now it's being published. So yeah, again, all of these inconsistencies. But I want to dial it back to when you know what it is that you're seeking in terms of healthcare, then you can find the right person to actually deliver that, right?
Yeah.
Like it is that, I think that is the most important message. It's like, look, you might have a fabulous relationship with your doctor, but your doctor is bound by the system that he or she is trained in. And if they have never ventured outside, they've never actually explored, thought about what more needs to be done, then they can only give you what they have been taught. You can't go to an Italian restaurant and order French food, right? So if there is no map, exactly. Yeah, like
get out of here, mate. Yeah. So,
and I'm not bagging the entire system. The system is set up the way that it's supposed to be set up, right? Yeah. So, but when we understand it, then we can say, okay, rather than fight it because you go, why are things working this way? It's not supposed to. It's like, no, it's actually the opposite. It is supposed to work that way. And if you want into that system, that is how you are going to have to behave, right?
Yeah. Yes.
So it makes so much sense. Different perspective.
Yeah, I think that's the thing. It's the perspective of it. And also, I think that just highlighting again that we don't want to be victims of a system. If you, like you said, if you want to, go to a normal GP down your road, you should know what to expect now, especially after the last 2 years, for your very special cases here and there, like yourself. There's not a lot of people that aren't going to be a part of the system because that's how their livelihood is supported. Otherwise, they lose their jobs too. And it's just the way it is at the moment, unfortunately. We've got a question here as well, HB. So it says it's from an anonymous, but basically they said you're making a lot of sense. As one of the aspects of this question is around monkeypox, do you think the medical pharmaceutical cartel is shifting the blame for some of the side effects from the vaccine onto this new disease? For example, the condition of, I don't really know how to say this, but bullous pemphigoid fluid. Is that, yeah, I hope I said that okay. Fluid filled. Thank you. I passed everyone. Fluid-filled blisters on the hand has been reported as a side effect from the vaccine, so as well as monkeypox. So do you have any thoughts here?
I think we're being taught to really medicalize what it is that is happening to us, right? And one of the things, again, just a slight tangent, because I need to give you context, yeah?
Yes.
This is the first time in history whereby you can buy a test that is supposedly diagnostic and then decide whether or not you have a disease, right? So people go, I have a cold, I'm swab myself. Yep, I'm positive. I'm going to stay home for 7 days, irrespective of how they are feeling, what happened. Like literally, it's like, okay, I've got this. Now you have the ability to swab yourself, go, I'm positive. Well, look, I would really like to get the treatment for this, which is available from the pharmacy, right? And that's what is being pushed currently, to go, oh my gosh, so many people are actually dying. So we need to give them direct access to the actual drug that is going to save their lives. And people are actually being trained because they go, hey, let's gate it. Only the really vulnerable people have access to this, okay? And then everyone else is like, what about me, right? Like, I feel like I have a health condition. Okay. So let's make the next step, right? Like, how do you then get more people to want the particular product, right? You just go, okay, this group gets it. So now we're going to open up to a different group. And then they go, all right, now it seems to be getting closer to me. Surely it's going to be us next, right? Now you're building anticipation. And then they're going, all right, if I get this disease, this is the treatment. So now you get to, you have basically taught the consumer how to make their own medical decisions. They just go, yep, I have this disease. This is the treatment. Get it. We're done. Right. And I see that this is going to continue rolling out. So when we talk about, okay, is monkeypox the actual covering of the side effect? Like there is a school of thought whereby, you know, if your body is in dis-ease, it is going to develop a symptom that is appropriate for your body type, right?
Yeah.
So some people, they get sick, they become snotty, they have headaches, they have fevers. Other people, they get sick, they don't get snotty, right? They get fatigue, they get insomnia, they get a different set of symptoms, even though they may have been exposed to the same thing. So it is not that straightforward to just say, hey, just because we have been able to see this symptom, you most likely have X, right? You're saying just because you had flu-like symptoms and then the diagnostic test shows that you had COVID on board, doesn't mean that COVID is the cause of all of those symptoms. Maybe COVID weaken your immune system and then therefore you have other infections that are going on. Maybe it has nothing to do with that, right? So like, and if we tease that out a little bit more to go, hey, what about the tests? I can't tell you the number of people who have symptoms, know that they're sick, tests are negative, right?
Yeah. Yeah.
And then they go, right, I'm going to continue testing. Day 3, day 4, day 5, they become positive. Huh, interesting. Were they not infected the first 3 days? That goes counter to all of the teaching we have in immunology, right? Or the opposite, someone who tests positive and they are completely fine. Or someone who has tested positive for 7 weeks and are still testing positive. And you go, where is this line, right? Like how reliable is the test? There is zero data that I can see which tells us how well used this test is. And we're using it as a screening test. It's bonkers. Like screening tests need to have a 90% sensitivity and at least an 80% specificity to be useful, so that you don't just screen people unnecessarily and become positive and then have to engage in treatment. Every population health control that we know of follows that guideline, except this current pandemic. So we just take a test and then we assume that that's how it's being used, right? I'm incredulous. I don't know. I don't even know what to say. You know, it's like we've just gone, we're going to do things a completely new way, never been tested before. And this is how it's going to be. No one is questioning it. Well, it's not that no one's questioning. It's that everyone this life is made easier if you just follow, right?
Yeah.
As opposed
Yeah.
to needing to think about it and go, yeah, that really doesn't make sense.
Are you seeing in the medical field, though, in this system, other doctors also, feeling this way and seeing this for what it really is? Because like Frank just wrote, it's like a mass psychosis, because honestly, it almost feels like, if you see your GP these days, it's almost a taboo subject. Otherwise, you got your tinfoil hat on and you're a crazy conspiracy theorist. But at the end of the day, like what are you seeing with other doctors? Because I know personally so many nurses and doctors that have left, they just don't want to be part of it anymore. But it doesn't mean they can't be healers, and it doesn't mean they can't still do something, out in this field. It's just, yeah, I think it's quite hard to watch, to be honest.
I just have the rescue helicopter flying over.
Oh, okay. So we'll just make sure that you stay on camera and we can see you actually. Let us know if you're in dire straits.
Look, I think like all of the conversations that we're having now, right? Like there is no real reason that you should be concerned about it as such, right? Like if you went to shop for a Toyota and then you went to a Mitsubishi showroom and you were like, I do not like the salesperson here, I don't like the cars, you leave and you go and find a Toyota showroom, right? You don't stay there and then just unload, right? Like, which is what a lot of people do. They like currently, and I'm not sure why. This I haven't figured out. It seems like they're like, no, it should be this way, and then they want the system to bend and mold itself to them, which is not going to happen, right? The system is going to go and function irrespective, because everyone who is part of that system is literally just doing their job. So yeah, that's what I keep hearing. The teachers say, I feel like a number, right? My school doesn't care about me. I've been working here for 26 years, and all they do is say, look, sorry, it's out of my hands. That came from higher up, right? And then they go higher up, go to a principal. Principal, sorry, no, out of my hands is the education department. Education department, sorry, it's the government that actually, pushed this down. So everyone is just passing the buck up. And then the government says, oh, no, actually, you have plenty of choice. We didn't do this, right? There's someone else who's asking you, right? So, like, I get that, yes, people have their freedoms and their things that they want to do. And yes, if you don't want to wear a mask and then someone has just asked you to wear one, they didn't single you out and then go, look, I have a personal vendetta against you. They literally have been told, right? Like their boss is breathing down their neck saying, hey, I don't want to see another person who is not wearing a mask in this shop. And they're like, look, okay, I better do that. Otherwise my job is under fire, right? I have completely forgotten what you've asked me. So
no, you pretty much answered it. And I think that getting back to ourselves and what we have control over, I think that's a really important thing to just kind of touch on again from your perspective and how you were talking before. Because, for example, how everyone has judgment on all these people, or you're choosing to be a part of the system and you're forcing others to do things that they don't want to do. Do you think that it's a healthy practice to look back at yourself again and think maybe in your life where you're also making your life easier by doing certain things that possibly aren't the best for others as well? Because I think that it is a part of our, human condition or whatever it is. Do you know what I'm saying here? It's just at the end of the day, we can point the finger at everyone will be so disappointed, but the responsibility comes back to us individually.
And that's absolutely right, Jasmine. And it's not easy, right? Like I say, hey, whenever you're pointing a finger, there's 3 pointing back, right? Exactly, saying maybe we need to look at ourselves. And as a dad, I experience this on almost a daily basis. I tell my kids that they should be doing this and they should be behaving that way. And right, why? Like they obviously don't think so. And am I right? Right? Like just because I feel that you should pick up your clothes, does that mean that you should pick up your clothes? Maybe they shouldn't. Maybe I'm wrong, right? And why do I want to inculcate that behavior? What does that actually mean? Like, they don't pick up the clothes. Is it a big deal? Right? And then people's minds tend to go in, and then they start to catastrophize. Well, if they don't have the discipline to pick up the clothes, then they're not going to be able to manage their finances. They're not going to be disciplined to actually study when they get to university, and then they're going to be on the streets, and then they'll have to sell their body so that they can actually feed themselves. Oh my gosh, I'm the worst parent in the world, right? And be like, okay, chill, right? Like, it's clothes that you're going to pick up, start off with. So the question that you asked previously, which just came back to me about my colleagues, right?
Yes.
It is so much easier for us to follow a system, because when you want to do something that is outside of that, it is tremendously difficult, right? It is like saying, okay, this car is left-hand drive, and no, I want to sit in the right-hand side, like how I'm used to in Australia, and I'm going to drive this way, right? You're literally asking them to do something that the system is not designed to handle, right? So it's no wonder why like most people are going to choose the easier route, because if you just conform and hopefully everything is fine, then you'll be okay, right? And this goes towards how amazing our body actually is and how much abuse it can take, right? We have something that has been proven to be toxic, right? We have medications that are proven to be life-threatening even. And majority of people are able to handle it.
Crazy.
Right? Now, we might not be able to handle it for 5 years, 10 years, 15 years, but within the last few years, we can deal with it pretty well, right? Like, the excess deaths in Australia has gone up by 18% for the exact same time period compared to last year. And, and they're labeled as unknown. We don't know why people are dying.
Isn't it sad? I've heard it's sad. Sudden adult death syndrome.
Yes, right? Like, sudden adult death syndrome. We got like sudden infant death syndrome. It's like, in infants, yeah, I can understand. In adults, you must be blind, like there's
an elephant in the room.
There absolutely is an elephant in the room, right? And the data just keeps stacking and stacking and stacking. And you can see how the world is changing, right? Like, let's take away health for a second. And then you just look at how politics is playing out in the US, right? And you see them actually go, hey, you know what? Even though we are 2/4 of GDP decline, we are not going to call this a recession, right? Like, that is just an outdated definition. Okay, great. What are you going to call it? Well, we're not going to give it a name. It's just what's happening at the moment. Well, that's very convenient. So you just get to change the narrative depending on how you feel, right? And then that delays the impact of it. So we do this exactly the same inside medicine. We just say, oh, look, this particular disease, it doesn't look like anything else. So we are just going to ignore it. It obviously doesn't exist. It's a mystery. Like, we don't know why it's happening.
Wow.
So, like, there is definitely how would you say? It's definitely a way that things are being portrayed and continually fed to us on a daily basis to show that, hey, we are fluid in terms of our definitions of what things actually are. Again, that was politics, right? What is happening in the LGBTQT XYZ community, right? Well, they've always existed. Okay, great.
Always.
They're not being marginalized. So why now do you need to do something? Like, why are we focusing on it, right? Why are we creating this divide and then saying, oh, look at all of these factions of people, right? And then it's like, okay, you're looking at a minority, but then you can force everybody else to do the same thing, and then you take away their freedoms and say, hey, tough luck, we're doing that for the greater good, right? So, like, completely nonsensical type arguments, and then people, because they are just mesmerized and literally just following the narrative, they go, yeah, that's right. We should stand up for rights for the minority, but let's forget about the majority, right?
Exactly. Yeah.
Hmm.
Wow. I think this has been so good tonight, HB, because you always bring such practicality to kind of the mess that everyone, feels that they're going through. Because reality, it does feel messy. It is stressful, especially if, you've got someone in the house that likes the news. I mean, there's still lots of people who watch it. I've been to a car yard the other day and the news was blasting. Honestly, my cortisol raised. I don't know if anyone else can relate here, but it's like it piques something inside of you because you just want to live life. And I think what's so important here is realizing that it does come back to you, and in everything that you're faced with in life, maybe asking yourself those questions, like going back to those questions, like you asked yourself when you walked down the hall, why did that thought come to me? About not wanting to get sick, not wanting. And I think that it's really good to maybe be a little bit more conscious about the things that we are trying to fight, and realize that some battles are just not for us, but the greatest battle is within ourselves and living to our truth. Would you think that would be a fair thing to say?
I think more than ever, what you said is very important, right? You need to know where your internal compass is guiding you. We're just surrounded by distractions. Yeah. And then at the end of the day, if you shut off your TV and you have no social media contact, and the only people that you interact with are the ones that you actually love and care for, how would that world look like? Right?
Yeah.
Like, I always tell my kids, if you don't like spending time with the person, like, don't spend time with them. There's no reason to, right?
Yeah.
Then I'm going to be like, people think that I'm unkind. They're going to think whatever they're going to think anyways, right? And you are thinking about someone who is probably not even thinking about you, right? Whereas if we were to serve ourselves authentically from the start and then say, hey, here I am, here's who I am, and here are the people that are important to me and whom I want to keep and form that relationship with, then you become part of that community that is going to then support you as the surrounding area evolves, right? Like that's the most important thing. That's why everyone else is here, because they found that, hey, there is a community of like-minded people, right?
That's right. Yeah.
But you want to be very careful not to be in a like-minded group that is only complaining about stuff, right?
Well, that's the thing. Yeah, exactly. And I think that's the shift as well, HB, that has happened in the few years as well of, leaving my corporate job, for example. When I first just jumped out of corporate world and came into this kind of world of freedom fighters, I was a bit perplexed. I was like, I don't even know why we're calling it that. There were so many people that were complaining, and it honestly made me sick. I don't know if anyone else can relate here, but because it was this big fight against the government and all these things that are happening, it was only when it was like shift your perspective and you realize the onus was back on you. And it's like, no, I don't have to hang around those people. No, I don't have to have a big sign at the front of my door, to get the police raiding me for saying something on the internet. I need to just get back to reality. What we focus on is what expands. And at the end of the day, sovereignty and what we teach here at the Global Wealth Club is really being responsible. If you want to create wealth, if you want to create health, you can, even in these times. It's possible, right?
Yes, absolutely possible. And again, by no means is any part of this conversation easy, right? We're not saying that, hey, you don't like your current doctor, walk down the street to the next doctor, and then bingo, you've got someone that you can talk to and understands your situation, right? Like when you have a real problem that is difficult to solve, you need multiple points of input. You might go to the chiropractor, the osteopath, the doctor, right? The shaman, whoever, right? And then you have to go and find the answer that is tailored for you.
Love it.
Not supposed to be easy, because if it was, you wouldn't have that problem in the first place, right? Like problems are there because they are a warning sign. Our body does not give you a signal, does not give you pain, does not give you worry, does not give you insomnia or anything else if you've got the message, right? So what is your body trying to tell you? It's like, oh, I'm tired all the time. Well, why are you tired? Like, what is actually behind the tiredness? Is it an emotional tiredness? Is it a mental tiredness, right? Is it that you're actually displaced from all of your supports? Is it that you're in the wrong job, right? Is it that you're actually being bullied and you're ignoring it? Like, what is it? The symptom is merely a warning sign. So your joints hurt. Okay, well, why do your joints hurt? Maybe it's because of your posture. All right, well, that's a possibility. Well, maybe it's because you have trapped emotions that may have originated all the way from childhood. Yes, that's a possibility too, right? Maybe like there's so many different causes for the exact same symptom. And this is what people have a hard time wrapping around. They go, how is that? What? It's my elbow. Like I didn't bump it and it's sore. Now it's constantly swollen. Well, maybe there's something else that is happening there. We are completely interconnected with this world. We are electrical, magnetic beings from a cellular level. This is indisputable. It is physics. Like you could not, you couldn't prove me wrong no matter how you look at it, right? You have a cell, the cell is a membrane. The membrane excludes ions. If it can exclude ions, it creates a gradient. What happens when there's a gradient? Ions move. When ions move, what happens? You get electrical charge. What happens when electrical charge gets created? Magnetic fields actually get created. It's like physics 101, right? So, and to think that people are willing to go, you know, all of this radiation doesn't matter. The Wi-Fi system doesn't matter. The 4G, the 5G, it's fine. You're like, okay. Even if I didn't have all of the data that says that it's not fine, your intuition should tell you that when I'm around some of these things, I don't feel the same way, right? And then as you develop that sensitivity, you begin to interact with your environment differently. So coming back to self, it's not just self-awareness from a mental point of view, an emotional point of view, but also a physical point of view. Like we need to be fully integrated and we need to take on all our signs and symptoms so that we know how we're feeling, what's affecting us. And as a result of that, we know how to gravitate towards things that are good for us.
Yeah. It's so true. And look, I think this has been such a good reminder for everyone tonight. It's come at such a good time, you know, even though the headlines are screaming and alarming everyone, you know, once again, just come back to yourself, your sovereignty of your health and your wealth and your family, and everything really depends on that. And you know, even you as a doctor, I would know no one's coming to save your health and work for it for you. You have to do it yourself. So I think this is a really good reminder. And kind of as we wrap up tonight, because we tend to like to stick it to an hour's time frame, if anyone has any final questions, chuck that in. But we are going to start a series very shortly, as we were talking about before, HB. And, you know, let me know, put your hand up or say if you're interested in coming along to that. It will be weekly because there's much more of an important time than now. To really look after your health. So HB will give lots of his great advice, keep in check, in touch with everyone, and also there will be opportunities to be a part of your health program. And I know that is something that so many people have benefited from. So let's have a look. Who else is there? All right, so we've got a final few questions. Just in regards to integrative health practitioners, there was a osteopath who was charging $800 for an initial consultation. Is that something that's quite extreme pricing that you would know, if you would know that? And what would an osteopath's training be? It's a big question.
Yeah. Look, my opinion is actually very straightforward. Like, so the way that I decide whether or not someone is useful for me is I muscle test. I go, all right,
love that one.
you know, I'm a potato. All right, good. You know, is this osteopath that I'm going to see going to bring value to me? And it's like, oh no, okay, then I don't go. Right? Like, I keep doing that because in my experience, I've learned that whenever I go against my own body's advice, then I get to suffer. Right? I might not be able to see how I'm going to suffer, but I will. Price is never the important determinant, right? Because at the end of the day, it's the value that you're going to get which determines what you have paid for and whether or not that is worthwhile for you. So, okay, initial consult is $800. If that $800 actually prevents you getting cancer, was it worthwhile, right? Now, we don't know the answer to that, which is why it is difficult to make that kind of a judgment. But what if I told you that the doctor you go to see for free is happy to give you chemotherapy drugs that are worth tens of thousands of dollars, which you never have to pay for, but you get to lose your hair, vomit every day, feel like you are literally shrinking, have your skin sag, your blood vessels actually burst, and your appetite disappear, right? You go, oh, that's a free though, right? It's not the amount of money that you pay. Now, the tricky part is finding the right person who can actually help you to then pay that money. I don't have anything better than my muscle test to offer for that particular question, right?
Yeah.
Because to me, everything is connected. You are an electrical magnetic being, and a muscle test is simply your body interacting with the wider environment and picking up the subtle signals that we otherwise do not have a way to interact with, right?
Yeah.
So that's why I use it, you know, like, is this supplement good for me? Yes, it is. Okay, I buy it, right?
Yes.
Is this food good for me? Oh, it isn't. Okay, I don't need it, right? Like, you can go to, there are really two sides to this, right? Like, I'm not necessarily a big fan of diagnostic tests, because then we're starting to rely upon an external thing to tell me the state of my health. The goal should be to tune your body so finely that you know, right, that you can feel the changes that you make and how it impacts upon your body. How does it feel when you exercise 20 minutes a day, every single day?
Yeah.
What does that do for you? How does your immune system respond? How does your sleep improve or not, right? Like, what happens when you eat walnuts as opposed to pistachios? Like, I eat all of them. It feels the same. You have no discernment, right? Like, do we need you to eat a nut that closes your airways before you go, okay, peanuts, no good, right? Like, you really have to be much more sensitive to that. Just like how some people can read other body language, right? Or empaths who can actually feel the emotion from other people. We need to be much better in tune with our bodies so that we don't wait until it's rattling and breaking before we notice that something is wrong, right?
Yes. Love it. It's beautiful. Everything you're saying is so in line with, I think, what really people need to hear. Okay, so let's go with the last question tonight from Robert and Katrina. Is it possible to see the muscle test you use again, please? So could you show us how to do that?
If you Google, go on Google, you will see a bunch of different ways to do muscle testing, right? The most basic one where you need to rely on someone else is when you put your arm out and someone to apply downward pressure, right? So you say, my name is HB, and then you hold strong, and someone tries to push it down, and they will feel that actually there's a lot of resistance. Then you say, hey, I am a mushroom, and because that's untrue, then it will go weak. And that's the easiest one to test best, particularly when you don't have any experience, right? So there are other methods whereby you can do 2 rings. I don't find that works for me because, again, I'm not as sensitive as I would like to be. But then this works really well for me, right? Having a ring and then 1 finger as a hook. If you look up kinesiology and muscle testing, you will see a bunch of different ways that you can do it. And then something very related to muscle testing is dowsing, right? So some people prefer using a pendant and then trying to figure out where it actually is pointing, and they get a much better sense of that. So I've seen people whereby they use dowsing, and then when it's a yes, the pendant moves forward. When it's a no, it goes backwards. And for them, it's clear to them. So they use that, right? You need to figure out what works for you. And this, like any other skill, like writing, you need to practice. And the more you practice, the better you get. And then you get to a stage where you're like, I am so comfortable with the answers that I'm getting because I've seen the past results that I can trust it implicitly now, right? And that's where I am at, right? So everyone needs to learn on their own journey. For me, it saves countless hours because everyone I talk to is a nice person. right? I go, should I go and see this physio? They sound really good. Should I go and see this chiro? They seem to know what they're talking about. Should I go and see this professor? They have like so many letters behind their name, right? Right now I'm like, okay, no, see you later.
You're like, not today.
Yeah, it's not
awesome.
not right for me. And I have yet to encounter a situation where I go, is this right for me? And like, I really wanted to go and see a particular person, and I would test like 1 month later, 6 months later, a year later. I was like, the answer is no, 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 no. And it never turned yes. Like I just stopped, right? Because it clearly is not the right thing for me. Right?
Yeah.
So that's just a little bit of my misadventures and how stubborn I am.
Just a little bit. But that's good. I think it's so great for these practical things. That's what we want to keep bringing to everyone here. Everyone is so appreciative of you. There's so many great comments. They want you to be the royal flying HB doctor around Australia. So if you're up for that, that would be really great. Yeah, maybe a nice global wealth club HB, you know, flying plane. And you know, I just think that for everyone here tonight, when you see that HB and you know is going to be sharing his knowledge, share with as many people as you can, because this is really the type of message the world needs to know: self-empowerment, sovereignty, and really taking your health back into your own hands. So thank you so much, HB, for your time. Thank you everybody for coming here tonight. And we're going to be back very, very soon. So check your emails. If anyone wants to get in touch with HB for any program that he's running or anything health related, obviously there are certain boundaries, but you can email us support@globalwealthclub.com and we will put you in touch with HB himself. Okay. All right. Thanks, HB. Oh, so good. I missed it, and everyone else seems to have missed it. So we will be back very soon, everybody, and have a good night, and make sure you go muscle test yourself before you try and have that chocolate before you go to sleep tonight, okay, everyone? And see if it's good for you or not.
Absolutely.
Yeah. All right. Take care, everyone. Thanks for coming. Bye, HB.
Bye, everybody. Thanks, Jasmine.
No worries.